There's two parts to the hip. There's the hip socket, which is called the acetabulum, and there's the thigh bone, which is called the femur. The hip socket actually sits at a slightly forward angle, and the head of that femur sits right in that socket. If you feel the pointy part of your hip right here, that is called the greater trochanter, and the center of that actually sits about 15 degrees behind the center of the hip socket in most people. That means for most people, if you stand normally, your toes will be angled out about 15 degrees. Some people have what's called a little bit of femoral anteversion. Those are the people that stand more straight-toed or even slightly pigeon-toed. On the other side, some people have a little bit of what's called femoral retroversion, and they stand a little bit more duck-footed. If you've ever heard a coach tell you that you should be squatting with your toes pointed straight forward, that is completely incorrect for most people. You want to be squatting with your feet in the most natural position when you stand. Stand with your feet shoulder width apart, wherever your toes want to sit. That's the best position for you. It'll increase gluteus medius activation for stability and decrease risk of injury. Thanks for watching.